I'd like now to welcome to the stage, and Don, feel free to take a seat, a man at the coalface of children's health in the region. Inspired by the legacy left by Dr Alan James, Dr Stewart Birt is the head paediatrician at Wollongong Hospital's emergency ward. Stewart, if you can come and join us, please. Ladies and gentlemen, finally joining Don and Stewart is Susan. Susan Wallis' family was shattered when, despite an uneventful pregnancy with her first baby, Gracie, was born with severe brain injury and multiple disabilities from the lack of oxygen. Susan was separated at birth from her daughter and husband as she sat on the helipad at Wollongong Hospital, an experience that no mother should ever have to see. She is now the face of the effort to create a world-class health facility and services for families in the Illawarra and Shoalhaven areas. Ladies and gentlemen, the announcement by Don, one of probably the finest moments that I believe has ever happened in the Illawarra since potentially discovering coal. This will take healthcare for our children to a level that as good as the world can see. Ladies and gentlemen, the process going forward is simply titled Our Leader, Our Town, Our Children, Our Time. The announcement today from Don, it must be very special for you.
Oh, it's very exciting. I think the most exciting thing about being here tonight is seeing the support that this group of people actually provide, financially particularly, but also in terms of encouraging the growth of children's services in the Illawarra. And for me, the role in the ED and even with the university is thinking that we're going to have someone who will lead paediatrics in our area for research, but also for teaching. I'm really passionate about the teaching aspects of that.
Stuart, I was going to say, a lot of people probably get confused about the relationship between a university and a hospital. Someone made a comment to me a few months ago, geez, it'd be nice if the university was involved in the hospital. Basically, when you have a medical school, the hospital is your playing ground, isn't it?
It's where you see your patients. It's where you also get to interact with medical students and where you get to teach future doctors. So the hospital is incredibly important in our area, but also the university's involvement within the hospital means that we're training doctors for our community who will go on and be our local doctors, both in general practice, within the hospital system, and future paediatricians is what I'm hoping who will come back to.
Well, you're obviously extremely passionate as a paediatrician. You coach my young fellows' rugby side down here, and I see how passionate you are with the young. It's obviously something passionate for you, but to be able now to train or to inspire the 300-odd students to say, well, let's get into paediatrics, let's learn about that. I mean, talk us through that as a young medical student.
Oh, I can definitely remember the time when I was a medical student and can remember those teachers of my experience who were future professors or have become professors elsewhere. And they were people I wanted to go on and emulate and continue to want to emulate, and who have taught me and also been able to, as a consequence, treat other children through their teaching of me into the future. So I'm passionate about the fact that the medical school, the teaching environment is important in terms of training people who will look after children in the future.
Susan, you've, and I was actually at our computer. Susan helps me with a lot of the things I do. And at the moment, Susan put that photo up on Facebook, and I actually saw you do that. It was a very personal time for you.
It was a very personal time. There are members of my family who haven't seen the photos that you've seen tonight because they're too painful for us. And I cried as I put those photos up. But this cause is so important and it means so much that I'm prepared to do that to make a difference. It's about making sure that that doesn't happen to somebody else. That's why I'm sharing that photo.
I mean, as I said, and I'm very privileged to know Stewart and Dr James, and Dr Brereton's here with us tonight as well, but, you know, they did everything they could at the hospital for you, the doctors at the time, and it just wasn't enough because, you know, obviously we are. The moment or at that time when you had to say, well, here's my baby and I don't know if I'm going to see her again. I mean, what does that go through in your mind?
To be honest, I've tried to block it out. I don't want to remember how bad it was. I will say that I very strongly remember saying to whoever was listening, pleading, take my legs, take my house, take my life, just bring my baby back to me. I was prepared to sacrifice my own life just to have her survive. And you're right, Wollongong Hospital did an amazing job saving that little girl, but they couldn't keep her alive. They saved her life, but they couldn't keep her alive. So sadly, she had to go on the helicopter. And my husband was forced to choose between staying with me, and I was critically ill, or going with her. And so I had to sit on the helicopter, sit on the helipad with an unknown person sitting with my wheelchair, and just watch the helicopter leave. At the time, there was no bed for me in Sydney, in hospital, and I seriously was facing the prospect of never seeing her again. That is a pain that no parent should ever have to experience.
When I was something I don't understand, because as I said, to touch wood, I've been very fortunate and haven't really, actually I don't think I've ever been into the hospital. When the helicopter situation, you've got a baby that's hours old. I couldn't understand when I was told that it takes 3 hours to get the baby from the facility there into a condition that needs to be put in the helicopter. That 3 hours must have seemed like 3 weeks. Stewart, possibly you and maybe Susan interact?
I'm just thinking aloud, there are a number of other paediatricians with Jeff and Alan James being in the room, but it is a very thought out process. It's a very time demanding process to actually get a baby organised to be able to go in a helicopter and to be in the safest condition for that sort of transfer or that sort of movement. It is a very stressful time for staff, patients, families, and no doubt it is a very demanding time at the moment when it's actually occurring. The other thing I'd say about it is it goes very fast, and then it's a time of being in another place, and that's probably the hardest time, I would imagine.
I'll admit that it wasn't as hard for me as it was for my husband. I was heavily medicated, I was unwell, and I suspect I was actually sedated, which was a blessing. But my husband was completely aware of everything that was happening. He was aware that his wife was sick, and he was aware that his baby was being prepped, and he had to sit and watch that process. So I don't have a recollection of how hard that was, and he struggles to talk about how hard that was. But I am aware that it was a 3-hour process, and I did get to see Gracie before she went, and to see that tiny little body in this massive crib on wheels. There are photos of that as well if anybody wants to share them. It is, I'm going to repeat myself, it is something that a parent should never have to experience. And I am working very hard with Lee and Don and all of the other crew to make sure that that doesn't happen in the future.
Well, Don, over to yourself. And I said, between what I said and what you said, we've covered a lot of ground in what we spoke about, but the vision of bringing the Professor of Paediatrics in, your vision, over 40 years of experience at the highest level of medicine this gentleman has, ladies and gentlemen. It can be done, can't it? We're not, I'll give an example. I was with someone the other day and I said, we should ask someone. They said, oh, no. They said, no, it can't happen. This is only Wollongong. Yes, and I just, straight away that word was said to me, oh, no, it can't happen. And I'm thinking to myself, well, why can't it happen? Don, do you want to follow through the why not?
Well, it will happen. I mean, there's not even a doubt about that. I mean, again, we got a medical school and everybody said we couldn't possibly get a medical school. And because of Jared's leadership, we got one. We've got a health and medical research that's now was actually full and active with a lot of research grants. Again, we got that going. What you need is an individual who's willing to take the reins and has a vision of where pediatrics can be. Now again, pediatrics has been successful regionally all around the world, so we have models to look at. What we need is a leader to come in here, take a look at what resources we have, where we need to go, and set up a vision for what we need in the way of training doctors for the future, as Stewart said, what kind of facilities we need. If we don't have them, argue for them, cajole for them, do whatever we need to get them, not take second base. And as a result of that, in a short period of time, and I would argue within a period of 6, 7, 8 years, you will see a major difference. we should be able to be in a situation where around 95% of all the pediatric conditions that walk into the hospital or walk into a pediatrician's office should be able to manage locally. And we can be there. So it can be done. It's just a matter of getting somebody who's going to take us down that journey. I don't have the expertise to do that in terms of a vision for that specialized field, but there are people that can do it. They have the passion. You look at the passion in this room tonight, we'll succeed. So it's not a matter of if, it's just a matter of whether it's going to be 5 years, 6 years, or 7 years.
And I think that what you've said and what I've learnt is that leader coming in, the job description that you've set is finding someone that embraces the community. What Don said about the person that is employed by the community, that part of that income will mean that person is committed to the community. They won't leave, they'll come here, they'll set up their family, they'll coach the rugby sides, whatever they may do, they'll come here, live, breathe Wollongong. Going back to what we said, our time, our children, our leader. This is our time to do it. Ladies and gentlemen, what Susan's gone through, congratulations, Susan, and where you are today. Gracie, 7 years old, you brought her in here all week. I know
She's been our office manager
I know
this
deep
week.
down she knows what's going on. Stuart, mate, big game tomorrow against Shamrocks, I believe. I won't be there, but you go and make sure our young blokes win rugby, but more importantly, get up to emergency and do what you do best. And ladies and gentlemen, a true leader in Don Iverson. A big round of applause.